So we're here today with Melissa. Melissa's a patient of mine, and Melissa, you came in with back pain a few months ago, right?
That's right.
Okay. What was going on with you?
I just found that my back pain was getting so bad I couldn't sleep, and so I came in to have it checked out, and I found that, or you found that my facets were off.
They were jamming.
They were jamming.
Yeah, you had facet syndrome.
Yes.
Facet syndrome is a common finding in my office, but it's not such a common finding outside. Matter of fact, a lot of people have never even heard of facet syndrome. So let me explain what it is. If we look at the spine, we can see that these two prongs ride up and glide up underneath these two prongs. These are called facets. So this is the sacrum, this is the fifth lumbar. The nerve roots come out, one on this side, one on this side, and it's held apart by discs. These are the discs right here. Facet syndrome occurs when these facets glide up too high and irritate the nerve root, and they can cause back pain and or sciatic pain, pain going down the leg. Actually, we have Melissa's x-ray. After we did a muscle test and we found out that she had facet syndrome, we took an x-ray. On the side view, Melissa's facing this way and her back is over here. On the side view, we're looking at the facet. This dot represents the top of the facet. So this piece of bone here that you see should not protrude into this hole. And you see, if we were to draw a line, the marking on this is a line across the bottom end plate of the vertebra. If we drew a line across that end plate, that line should be at or below this dot. And of course, as you can see, that dot is going to be above a line drawn across here. It means that it's compromising the hole. In addition, look how narrow the disc is. See this disc space here? Whereas how much fatter these are? This disc has narrowed, allowing the facet to ride up into the nerve root. So this facet has to be pulled down. So when we do that, we do what we call distraction, where we just pull down on the facets, on the sacrum, pull these facets down on our table, and then we'll put her on the side posture and with a little more vigor, pull these facets down. And once you take these facets down, it's not irritating the nerve root anymore. Melissa, how long did it take for that facet syndrome to disappear?
It was immediate relief that I received from the treatment.
We've got her doing some exercises to keep those facets down, right?
Yes, I do a couple at home.
Great, excellent. Okay, so that's the difference between facet syndrome and a disc bulge. You can have a sciatic pain and back pain from a disc bulge and from facet syndrome. One is very simple to treat, the other is done by surgery. So we want to make sure there's no mistake made that your back pain is coming from the facets and not from the disc bulge, because if it's from the disc bulge, or if the doctor thinks it's from the disc bulge, a surgery may occur and it may be unnecessary, and that's why there's actually a CPT code for failed low back surgery syndrome, because many of the surgeries are done unnecessarily. Okay, thanks very much for listening.